Hi there, my name's Sarah Stanbury and I work at Yorkshire Humber Improvement Academy, part of Bradford Institute of Health Research. I'm just going to share two outputs with you from interviewing a deaf person, followed by organising a patient public involvement focus group with deaf participants. So just to share that I have permission from the deaf person I interviewed to give her first name and to give her a brief background. Her name was Gu. She's in her 30s. She's in full-time employment. She actually has her own company as a business consultant where she supports deaf people in like coaching them, advocating for them, sometimes attending healthcare appointments. She's a great person to interview, very insightful, as she had hearing until she was 3 years old. So she does have a voice. She's able to use her voice to communicate. She wears hearing aids and she lip reads, and she also is a British Sign Language user. In the interview, she wasn't able to give me any personal stories around escalating concerns from her perspective, but she gave me a general insight as she works closely with the deaf community and she has lots of friends that are deaf. She had a few stories to share. Just to say that the key points and themes were mainly around NHS accessibility and communication. Some good practice and some examples of things that could be done differently in learning. One of the key things that she shared with me is time and communication. She said deaf patients often need more time in appointments to ensure clear communication, and this often hasn't been organised before. So where a hearing person might have 10-minute appointment for something, she said they'll need 20 minutes, and prior to that appointment it hasn't always happened. So it's things to think about before speaking to a deaf person, as they need more time. She also said that deaf people are aware of the NHS pressures and the time constraints all over the news and social media. It's something that they're aware of, and they often feel uncomfortable to advocate for themselves, to ask for additional support or escalation. So that's something to think about. Good practices. Examples where she said it's brilliant when they have visual displays and subtitles because they can see when their appointment is, if they're in ED, for example, because she said that deaf people have often missed appointments because they haven't heard their name being called out. She said just a tap on the shoulder is good enough for them. She also shared around NHS staff perhaps being educated a bit more around deaf people, about some deaf people can talk, some deaf people can't, and usually if they're using British Sign Language is because they don't have a voice. She also said about accessibility, getting a translator. She said it should be accessible 24/7. She said she had a number of stories where people have been to appointments or waited in hospital and interpreters never turned up, and then the doctors or whatever have spoken to the partner and then they felt inadequate, the deaf person, and a bit vulnerable as well, because it's not making them feel good that they haven't had the communication directly directed to them, but they've spoken to their partner instead. She, as a consequence of this interview, we chatted and we felt that it'd be a good idea to formulate a PPI focus group and do some co-design work. So me and Gu got together and we got a few questions organised and got a flyer out. I had about 6 deaf participants who got in touch. Some of them were her contacts, so it's quite exciting. Got an interpreter, took quite a long time, got a little budget together. And I learned quite a lot in the process of getting an interpreter. Wasn't as straightforward as picking up the phone and organising it. Took time to get the right one. I've done a bit of work in the NHS as well. It's a bit helpful. Just to say, this was online, this group that I was organising. So we had the survey questions, like pre-populated, co-designed, but the idea was we were going to have the focus group to actually get, hopefully the idea was to look at the survey questions and decide if they were suitable and adapt them and then send them out to the wider deaf community so we could hear a bit more. However, 2 hours before the focus group, the interpreter got in touch with me and said she couldn't come. So that was disappointing. And when I was trying to rearrange it, it just sort of, to be honest with you, it fell apart. Some of the deaf people emailed me and said they didn't want to be part of the research anymore. And some of them were quite direct and said that they felt like it was a bit of a tick box. They'd been surveyed their whole life. which kind of got my heart a bit as it on a human level, because really I do care about the deaf community and I want them to feel that they're being listened to and cared for, as all of us who work in the NHS do. And some of the learning, really, I've got a document to share. I won't go through all the points, but the crux of the matter that I learned from organising the PPI focus group that didn't happen was I need to establish an ongoing advisory group rather than a one-off focus group. And it was all about relationship building and trust for any sustainable focus group. Like I said before, when they said to me, we've been surveyed all our lives, I think they're also aware that other things are like neurodiversity is a bit of a buzzword now, and deaf people don't always feel listened to. But I would say that the learning that I'll take away from it is about the relationship building and trust, and establishing an ongoing advisory group rather than a one-off focus group, but also considering co-facilitating with a deaf person who's already trusted by the community is another angle I'd go. It's also, recruitment did take a bit longer because there aren't as many deaf people, and also I think a lot of the deaf people do rely on hearing partners and things. Thank you for listening. I hope that's given you a bit of insight. I could talk all day about this because I feel quite strongly and passionate about it, but I hope that's given you something to work on. Thank you.